Welcome to the Dementia Radar demonstration video. The Dementia Radar is available to users with patient-level access. It can be found on the WSIC landing page under the Long Term Condition Management product, and then by selecting the Dementia Radar icon on the far right. The Dementia Radar has been created in collaboration with clinicians and has several functions to support the improvement of care for patients living with dementia. The purpose of this radar is to ensure patients receive a timely diagnosis and are correctly coded onto systems in order to receive adequate follow-up care. In particular, highlight those who may be more vulnerable, whose needs are not being met, who may not have access to relevant services, and those with emerging dementia who may need to be kept under regular review. The Health Borough, PCN and practice filters will either be already selected for you depending on your access, or you will have the option to select which Health Borough, PCN or practice you are most interested in. The age band filter will allow you to segment those with dementia into smaller age ranges. The patient segment filter is a very useful filter which enables the user to select cohorts of individuals with particular health needs, to proactively target vulnerable patients and manage them effectively. The sort by and sort order forms a two-step process for creating your chosen view. In this step, a user chooses a metric of their choice that will be used to sort the entire list of patients by any one of the options they select within this filter. For the purpose of this demonstration, I have selected non-elective admissions. A user will then select the sort order, for example, descending, and the results of the to selection will be a list of patients where the patients who have been coded with a particular diagnosis or those with the highest results will be listed first. By default, the radar will display the top 500 patients based on your filter selection. If the user wants to focus on a much smaller cohort of patients, this can be achieved by changing the number within this field. The data sources within the radar include GP data and acute activity. By referring to the purple banner at the top right, you will be able to identify the latest data within the radar and the latest refresh date. Hovering over the eye icon will display a tooltip containing further information, the data provenance, a hyperlink to the WSIC YouTube channel where dashboard demonstration videos can be found, and a hyperlink to the WSIC website where more supporting materials such as the user guide can be found. On the radar itself, within the first few columns, you are presented with patient details followed by total spend year to date and ethnicity. Total spend year to date accounts for a patient's estimated patient spend based on their activity across multiple care settings. Ethnicity is based on coded data within primary care. Dementia cohort. A green tick will be present if a patient has been diagnosed with dementia, delirium, or mild cognitive impairment at any point in time. A green tick will also be present if a patient has been prescribed dementia medication with no dementia diagnosis, giving clinicians the opportunity to target patients' prescribed medication for dementia and ensure a formal diagnosis has been coded into their GP records. Service use within the last 12 months. A red flag will be present for elective admissions, non-elective admissions, A&E attendances and DNA if a patient has had 3 or more admissions or DNAs within the last 12 months. An amber flag will be present if a patient has had 1 or 2 attendances within the last 12 months. GP contacts reflect GP-coded activity during a consultation, like blood test requested, onward referral. GP contacts exclude prescription requests and administrative events. 100 or more GP contacts within the last 12 months will reflect a red flag. 99 or less GP contacts within the last 12 months will reflect a grey indicator. A patient's social isolation status is based on a number of different codes which can be found within the calculated definition section of the Dementia User Guide. A green flag will indicate that a patient is not socially isolated. An amber flag will indicate a patient may be socially isolated. And a red flag will indicate that a patient is socially isolated. Long-term health conditions. EFI, or Electronic Frailty Index, is a national tool for assessing frailty of each person in the population. It is based on 36 deficits within 8 different categories. For more information, please refer to the Dementia User Guide. The number seen within the LTC indicator is based on the number of QOF long-term conditions coded within primary care. A green tick will be present here if a patient has been prescribed insulin within the last 12 months. A red flag would be designated for someone who hasn't had an annual review, and a green flag will be designated for someone who has had their annual review within the last 12 months. Hovering over each indicator on the radar will display a tooltip, which will provide the user with more information relating to the indicator, relevant dates, a patient's registered practice, and patient details. There is also an option to navigate to the Integrated Patient Summary page by clicking on the hyperlink at the bottom of the tooltip. The Integrated Patient Summary dashboards consists of patient spend, GP activity, GP prescriptions, social care, acute diagnosis, acute procedures, and the patient profile dashboards. The current view consists of the patient summary page, which displays patient activity within different service settings over a period of time. Hovering over the swim lines will provide the user with useful information regarding that activity. If you wish to learn more about the suite of dashboards that form the Integrated Patient Summary pages, please refer to the Integrated Patient Summary demonstration video in the description box below. The NHS Long Term Plan sets out ambitions for 2023-2024. It commits to improving the care provided to people with dementia, whether they are in hospital or at home. To assist with service improvement locally, the Dementia Dashboard has been developed and tested by clinicians. If you feel this dashboard will be useful in helping you to achieve national goals, to achieve and maintain a diagnosis rate of at least 2/3, 66.7% of the prevalent population, increase the number of people being diagnosed, and improve the quality of post-diagnostic support, please contact the WSIC team to gain access at nhs.nwlicb.wisicsupport@nhs.net. Dummy data has been used throughout this demonstration video. Thank you for watching.